So lumbar microdiscectomy is a common procedure. That is a procedure that we do because of a ruptured disc. So this is a spine model. We have vertebrae or bones which are stacked one on top of each other. The disc is the cushion in between our vertebrae. And when we're younger than about 30, our discs are very spongy. They've got a lot of water content. As we do get older, they can start deteriorating. But our discs have a fibrous coating over them. The discs are pressurized, kind of like the tires on your car. So if you get a weak spot in that coating, the disc is going to herniate, kind of like if you squeeze a jelly donut. So a lot of times if you get a disc herniation that's pressing on the nerve, you're going to have leg pain, or you might know it as sciatica. But it's going to be distinct nerve pain going down your leg. And if we do an MRI scan and find that you have a ruptured disc pressing on the spinal cord, our doctors can do a microdiscectomy. So that's where they do a small incision. They go in and they'll have to remove just a little bit of the bone, enough to get in with their microscope, and just simply remove the part of the disc that's herniated out. They don't do anything with the disc that's where it's supposed to be. That's an outpatient procedure. If you just have one ruptured disc, it's likely to take about 45 minutes. You're put all the way to sleep, and then when you wake up from surgery and your pain is controlled, you can go home that same day. You can have some back pain associated with the incision, but usually it's not too bad. We do send people home with narcotic medications and muscle relaxers, but typically you only need those for a few days. Sometimes the anti-inflammatories will help with any residual nerve pain or also some of the muscular pain. So you could expect to have some nerve pain remaining. It can sometimes take a few weeks to as long as 12 to 18 months for the nerve to completely heal. But most of our patients get pretty immediate relief from this. If you don't, reach out to our office and we can talk you through that. There are things that we can do for the nerve pain. Once you've had your discectomy, you're going to go home. You're going to take it easy. You're going to not lift more than 5 or 10 pounds, not do any significant bending or twisting. For the first 4 weeks, we just want you really to walk for exercise. And then after 4 weeks, we'll let you gradually get back to more normal things. Return to work is going to depend on what you do, so you can talk with your provider about when the right time for that's going to be. So you can have a ruptured disc. Anybody can get a ruptured disc. It's just you get a weak spot in that coating. Sometimes we hear people say, I sneezed or I lifted something, but there's not always an injury. You can be more likely to have a disc herniation if you smoke, if you are overweight, if you have just a genetic predisposition, but really any of us can get a ruptured disc at any time in our life. So for disc herniations, you don't always have to have surgery. Sometimes we can treat it very effectively with anti-inflammatories, physical therapy, lifestyle changes. It's just if we can get your quality of life back to where it needs to be without doing surgery, then that's great.